And good evening. Thank you so much for joining us for today's Community Telephone Town Hall. My name is Zoelle Stackhouse, and I'm the Special Assistant to the Deputy Chief of Staff of Mayor Muriel Bowser. Today, we are again joined by Chancellor of DC Public Schools, Dr. Louis Farabee, who will be providing an update on DC Public Schools COVID protocols regarding testing in schools. This is the second of 3 telephone town halls on this subject, so please be sure to follow along to have your questions answered. Before we get started, I'd like to remind everyone that if you would like to ask a question at any time during the call, you can press 0 and you will be added into our speaker queue. And now, I would like to pass it over to Chancellor Dr. Farabee.
Good evening. Welcome, everyone. Thank you for joining us this evening. I am Louis Farabee, Chancellor for the District of Columbia Public Schools, and I'm excited that you joined this conversation tonight. We are looking forward to chatting more with you today about our COVID testing in DCPS. We chose this question because we know that this is a very important topic to family, and staff also is asking questions. We want to ensure that both families and staff are very comfortable with our testing protocols and processes during this time. Today, I have a few of our colleagues that will help with this discussion. I am pleased to announce that we have joining with us tonight Dr. Brent Elliott, who leads our student support work, including our health services team, Sharon Gaskins, who leads our resource strategy work, and also Dr. Heidi Schumacher, who is in our sister agency of the Office of the State Superintendent of Education, who leads the health and wellness team there at OSSI. I want to remind families that, again, as we dig into the details today around our testing protocols, how positive COVID cases are handled and reported. So before we dig in, I just want to remind everyone that this is one piece of the pie. In this slide, we provide an overview of how we report and isolate, how we investigate, and then thirdly, our notification and quarantine. Our staff will dig deep into these topics tonight, again, around reporting and isolation, how we investigate a positive COVID case, and then also notification and quarantine. Now at this time, I am pleased to turn it over to Dr. Schumacher, who will kick us off on the discussion for tonight.
Thank you so much, Chancellor, and great to be with you all tonight. I will start with just a brief overview of the basics of the COVID-19 testing program, which is being operationalized at DCPS as well as at a number of our participating public charter schools across the city. So first and foremost, the Centers for Disease Control and DC Health strongly recommend offering asymptomatic coronavirus or COVID-19 testing in schools, as the Chancellor said, as part of a layered mitigation strategy. So lots of strategies coming together to ensure the safest environments for students, staff, and communities. COVID-19 testing, of course, helps schools to identify potential cases of coronavirus quickly and to reduce the risk of infections at school. Because we have implemented an opt-out protocol, all DC Public Schools students are automatically eligible for asymptomatic or symptomatic testing within their school unless the family completes an opt-out form. Those forms are available in all schools. If you wish to opt out, you certainly have the opportunity to do that, but otherwise all students are eligible to participate in both the weekly asymptomatic program and testing in the event that the student or staff member develops symptoms of COVID-19 during the school day. Actually, if we can go back one slide, the COVID-19 test that we use as part of this centralized school-based testing program is a saliva-based PCR test. PCR tests are typically considered the gold standard of diagnostic tests for coronavirus. The test is non-invasive. It's simply you literally drool into a tube. It does not require medical personnel to collect the sample, although we do have trained staff at each site supervising sample collection. And the sample is collected in a small test tube. Just a very small volume of saliva is collected from each participant. There is a link here to learn more about the test, and there are other video and written resources available on the internet. Next slide. And then specifically, the vendor that we're working with is called Shield T3, again, a saliva-based testing vendor. Basically, there are 3 overarching buckets within the space to get ready for and implement the test. First is preparation. So each participating school hopefully is reinforcing with students, and we welcome you all, our families, to reinforce to your student that before participating in a saliva-based test, like the one that we're using, it is important to not eat, drink, brush your teeth, apply lipstick in the hour before the test to make sure that that drool or saliva is as clean and clear as possible. Individuals will sanitize or wash their hands and then hold on to a vial and funnel. That's the place into which that student will drool their saliva. Then the next row you'll see is to provide the saliva. So you remove the cap to the vial, attach the funnel on top, drool into that funnel, and certainly this trained staff that is on site to support students in doing this successfully are coaching students through each of these steps. You then finally remove the funnel and screw the cap on at the end. And then the student will simply hand that funnel and vial back to the trained staff who scans it to make sure it's appropriately identified to that student. Again, the individual supervising staff person will write the student's name on there, scan it, send it off to the lab, and then you all as the parent or guardian will have access to those results by the following morning using the portal that your school can give you information on how to access. So with that, I'm going to turn it over to Dr. Elliott to walk through more of the protocol at DCPS.
Good evening. So I'm going to speak to you a little bit about what this screening actually looks like at our school. So once per week, each of our DCPS schools participates in the COVID-19 screening testing. Again, as Heidi mentioned, this testing is managed by a company, Shield T3, via Aussie, her team's leadership. The goal that we have for each of our schools is to test at a minimum of 10% of enrolled students on a weekly basis. And students are randomly selected so that we're getting a good sampling across the school community, so not the same students testing each week. Once the test takers arrive at school, they take and collect those samples. As Heidi has just indicated, those tests are then processed at the lab and results are shared with our families, as well as the DCPS Covet response team. So families are given information of how they can access the information in the Shield T3 portal, so they can almost immediately get a text on their cell phone if they've entered their cell phone number when those results come in, or by email. Our COVID response team at Central also receives those results as soon as they're available, and we reach out to our schools to ensure that they're aware when they have a positive case so that we can follow up with notifications to impacted individuals, including folks that have tested positive, but also members of the school staff or students who might be identified as close contacts. We also then follow up with what we call a community notification or community notice, so that the whole school community is aware when there has been a positive case. So we're going to just touch on a couple of frequently asked questions. The first one, what kind of COVID-19 test programs are done for students at schools? And again, we offer two. We do both symptomatic testing and asymptomatic testing. So symptomatic testing is a student is presenting with COVID-like symptoms. In that case, if you can imagine, a student has arrived at school and sometime during that day they start to show symptoms of COVID-19. The student would then be escorted to our health isolation room on that campus for an assessment by one of our health professionals, one of our RNs. Contracted RNs will come over. They will do an assessment of the student, and if appropriate, and the student actually is opted into the testing program, they will also administer the COVID test right then on site. The second part we've been spending most of our time so far talking about is that asymptomatic or screening testing, and that is the random testing that is happening each week at our schools, testing between 10 to 20% of our students. And again, for asymptomatic, these are not students that are showing any symptoms. It is just certainly, we consider that to be a surveillance measure so we can really have a good understanding of the health and wellness of our schools. Next slide. Frequently asked question here. How and when will I find out about the results from my test? Again, families are given information by the school of how you access the Shield T3 patient portal. Students, upon testing, actually leave with information for families, but also that information has been emailed to families as well. So you have to go to the patient portal, use the school access code, and actually set up an account so that you're able to access the results. And the results are usually available between 6 and 12 hours. Shield T3 is turning those tests around very quickly, which is great that we're getting timely information of potential positive cases in our schools. And additionally, a second measure we have in place, in addition to families being able to get that information, central office team also monitors that database, and if we are alerted of a positive case, we reach out to the school to notify them so that they may notify any impacted individuals. DC Health also follows up with, in many cases, with parents and guardians or adult students as part of their routine procedures for monitoring COVID-19 in our communities. Next slide. What should I do if my student's COVID-19 result is positive? This is a really good and important question. So if the result is positive, that means the student has the virus, has COVID-19, and could spread it. And you should definitely contact your child's health care provider immediately if you get a positive case. But you should ensure that your student is isolated, stays home, and follows the health and school guidance in any guidance that you receive from DC Health. If the student is on campus when the result is received, the school will isolate the student until the parent is able to pick the student up from school. And we will give you information with regards to any required quarantining. And as any lab test, there is this small risk of inconclusive false positives or false negatives. In the event of any of those concerns regarding your health or presence of symptoms, you're strongly encouraged just to follow up with your health care provider. And then I think finally, what should I do if my student's COVID test is negative? If the results are negative, this means that the virus was not detected in the student's specimen at this time. The student should continue maintaining mask wearing, following our guidance around proper hygiene, social distance or physical distance as recommended by DC Health. And if the student has a negative result but is symptomatic or has been a close contact of an individual who's tested positive, they should follow the guidance that has been provided by DC Health or that you may have received from our school. So we definitely at our school level give you guidance if you're considered a close contact, and you should follow that guidance with regards to any required quarantining. If the student does develop symptoms, you should call your health care provider regardless of the test results. So if you've tested at the school and the result is negative, but your student is really feeling unwell, follow up with your health care provider because there may be some other things that are going on. And I think now I'm going to pass it over to Sharon Gaston.
Thank you, Dr. Elliott. So I will share a bit about COVID-19 staff testing within schools. I will share that in many ways it mirrors the program that Dr. Elliott talked through. It's saliva-based and it's administered by the Aussie vendor Shield T3. In some ways it's different, which I'll talk through now. We offer both asymptomatic and symptomatic testing for school-based staff. It is an opt-in program. All school-based staff are provided the opportunity to opt in to receive testing at the beginning of the school year, and they may do so also on site at their school site. Those staff members who are unvaccinated may complete the weekly asymptomatic testing within their school buildings using this program. They're able to use those test results and upload them into DC's human resources system to satisfy the requirement for the mayor's vaccination order that's required for any unvaccinated DCPS staff member. We know that beginning November 1st, all staff working regularly in schools must either complete a full course of the COVID-19 vaccine, and those with approved medical or religious exemptions would continue to be able to access this weekly asymptomatic testing under this program. On the symptomatic front, again, similar to students, people who are experiencing or displaying symptoms of COVID-19 may access on-site testing through the Shield T3 testing program. And so similar to the student program, if they're in the instance that there is a positive case, those protocols and those notifications will be carried out. And so with that, I'm going to turn it back to Chancellor Farabee.
Thank you to all our presenters for the content shared tonight. Again, we want to ensure that families are all clear on our protocols of how we investigate any case of COVID-19, how we communicate, and then what the quarantine procedures are. This time, we're going to turn it back over to the team to facilitate the Q&A of tonight's session.
Thank you, Chancellor. So, like he said, we're going to transfer over to our question and answer portion of the program. Just as a quick reminder, if you would like to ask a question, you can press 0 now and you'll be added into our speaker queue. And if you're joining us via social media, you can comment your question on our Facebook and Twitter live streams using the hashtag DCHope. Our first question is coming from social media, and we have some folks wondering how long does it take for parents and students to be notified if there's a positive case in their school?
Yeah, thank you for that question. So, of course, we want to share that information as soon as possible. However, there are a number of factors that determine how quickly we're able to share that information with families. But we communicate directly school-wide, and then we also communicate to close contacts. And then if it's a classroom case, we also communicate directly to those individuals in the classroom. So I'm going to turn to Dr. Elliott, who can talk a little bit more around our turnaround time and the factors that may impact our turnaround time for communication.
Certainly. Thank you, Chancellor. Again, we're finding with Shield T3, families get results super fast. So if you've signed up, in the portal and you're getting the automatic alert, typically you're able to get your results between 6 and 12 hours, no later than 24 hours. We've not seen any results take longer than 24 hours. And then central office is receiving that information at the same time. And so our goal is, again, as the Chancellor pointed out, to get information as quickly as possible to impacted folks, including close contacts. And so, once we get that information from the database, we notify schools and start what we do is contact tracing to be able to identify all impacted individuals. Once that investigation has been completed by our contact tracers, we start notification. And our goal is to get contact tracing done within about 6 hours. For some complex cases, it may take us to the end of the day. But as soon as we have that information, we start isolating folks and ensuring to the greatest extent possible, we're doing everything proactively to prevent any potential spread.
Thank you. And as a follow-up, parents would like to know, how are close contacts determined, and are teachers, custodial staff, or cafeteria staff considered close contacts?
Do you want me to go ahead?
Yeah, so close contact definition is different for students and staff. It will vary depending upon the space they're in and the amount of time that the person has interacted with someone who's tested positive. But again, Dr. Elliott can speak to the time period and the protocols of how they vary between students and staff.
Yes, happy to add a bit more on, but that was perfect, Chancellor, a great introduction to that. So yes, anyone who has been in close proximity during the infectious period of a positive individual could be considered a close contact. So that could be custodian, front office staff, a classroom aide, a volunteer. So it's so important that our schools keep really good records of who are the folks that are in our buildings. And we also are still limiting visitors to our schools for that reason. And so again, the definition for close contact, as the Chancellor pointed out, is a little different from students compared to adults. So CDC approved for students in classroom settings, a close contact of student to student being closer than 3 feet proximity. So within that 3 feet measure, and it used to be all the way to 6 feet, but in situations in classrooms where we have enhanced ventilation, we have universal proper mask wearing and other mitigation factors in place, we're able to use that 3 feet guidance. For adults to adults or adults to students, that definition of a close contact expands to 6 feet. And again, that measure is, have you been in closer than whatever the length of distance is. If you've been closer than that distance for more than 15 cumulative minutes in a 24-hour period during the person's infectious period. And the infectious period being 48 hours before onset of symptoms or 48 hours before the receipt of a positive case. So it's a little complicated, but we have trained contact tracers that are able to do a really good job of narrowing and identifying appropriately who are the folks that meet that qualification of being considered close contacts, so that we can isolate those folks, get them into quarantine as soon as possible.
Thank you. And we're going to go to our phone lines. We have a parent of a Marie Reed student. Kristen Santiago, your line is unmuted.
Hi, thank you for the time today, and I appreciate everything that the schools are doing. I have a few questions. One is just starting with, there's like no social distancing for the small kids. They're not capable of doing that. So what can we do to increase the rate of testing? If we can get to 100%, that would obviously be ideal. But the rate at which testing has been happening doesn't seem thorough enough. And is there something that we as parents can do to help provide take-home tests or things when a student has been identified as having symptoms, so that people can take something home so they don't have to then go off and find the site to get tested? And then I have questions about kind of aftercare. How are classes mixed, and how does that work with the contact tracing? And then sounds to me like the little kids are not really being tested. So what can we do to help the little ones get tested? And those are the ones who are most likely to drool upon each other and cough on each other. And then also concerns about the opt-out situation. So I don't know the solution to that, but just concerned that my kid may be sitting next to someone whose parents don't want their kid to be tested. So a lot of questions, and I apologize for everything. But thank you for what you're doing, and we're just concerned as a parent community. Thank you.
Yeah, thank you so much. So we have a series of questions that I will start with and then also turn to Dr. Schumacher, who can talk a little bit more about our testing, and Dr. Elliott can talk a little bit more about many of our protocols are similar for contact tracing for before and after school care, and we do monitor closely interaction. I want to be clear, though, that our current testing model is not a requirement and mandate for all students, so families do have the opportunity to opt out. But all students are automatically opted in, and then if a student and family wish to not test, we ask that they complete a form indicating so. We are doing surveillance testing, and our surveillance testing model is in alignment with the recommendations from CDC and DC Health. We continue to advance our strategies for our youngest learners, which are included in our testing, to ensure that they are comfortable and can complete successfully the saliva-based testing. I do want to point out that we chose the saliva-based testing because it is less invasive and can be more comfortable for our youngest students, and we're finding that we're having greater success as we practice this procedure with our youngest learners. So I'll start there, and then I'll turn it over to Dr. Schumacher and Dr. Elliott if they want to add additional context.
Thank you, Chancellor. Thank you, Chancellor, so much. That was great. I don't have too much to add. As the Chancellor mentioned, we at the State Superintendent's Office worked very closely and continue to work very closely with the epidemiology and community health teams at DC Health to develop the protocols. And as the Chancellor said, the 10 to 20% random sample continues to be the recommendation from our health partners. Certainly, as the Chancellor mentioned, we also are doing a lot of work to coach all of our students, young and old, with the best practices to appropriately and effectively produce a saliva sample. I am the DCPS parent of a pre-K4 student, and I can say with coaching he has finally gotten it down, but it took a bit. And so we are happy to continue to provide resources, videos, other tips and tools, and our on-site staffing supervisors that are supporting the on-site testing events also have tips and tools that they will continue to offer, especially to our littlest ones who do sometimes need a bit more time. I will just say, I believe part of the question too was on symptomatic testing, and we're really pleased to be able to offer on-site symptomatic testing to any individual student who had not opted out of the program. So prior to dismissal, to the greatest extent feasible, DCPS offers that symptomatic test. And as Dr. Elliott said, typically those results are turning around much quicker than many of the commercial labs available around the city. And Dr. Elliott, not sure if you want to add anything else.
Pretty comprehensive. I would just add that in the 5 weeks so far of school, we have been able to administer more than 18,000 COVID tests in DC public schools with a positivity rate less than 1%. So in the 18,000 tests that have been administered in our school district, it's 110 positive out of that number, so 0.6. So just above 0.5% positivity. So we're really pleased with those rates. We are very close to being at the 10% and are pushing this upcoming week to be past 10%. Our school leaders are certainly seeing the value of these protections, this additional mitigation strategy. And so we're continuing to just be sure that we're doing everything we can do to ensure that our communities, our school communities are safe and healthy.
Thank you. Our next question is coming from Facebook. Ellen Stacy would like to know, do parents have to give consent before their child is tested?
Yes, so the family is automatically included into our testing model unless a student opts out. And it is a form that the parent would complete, and sent back to DCPS if they wish for the child not to be tested.
Thank you. And then the next question, if my child tests positive or is near someone who tested positive, so they were found to be a close contact, is there any way that I can have my child tested at the school rather than having to go to an outside testing site?
Dr. Elliott, would you like to please speak to our testing protocols?
Yes, sir. Happy to. So currently, we don't have in place a strategy for testing close contacts. Again, a close contact is someone who's been in close proximity to a person who is COVID positive during their infectious period. And so our strategy to reduce spread is to get our anyone that's identified as a close contact out of the school community as quickly as possible. Certainly, there are testing sites across the city. The mayor has stood up so that you're able to get a test within walking distance, a really quick walk anywhere that you live in the city. But we currently don't have a model for providing that in our schools. And I hope you can see the complexity of that, considering that those close contacts would be considered infectious. But I'll turn it to Heidi because I think there's some things we've been thinking about around this area already. So.
Thank you, Dr. Elliott. You're spot on with that. I'll just build a little bit on what Dr. Elliott shared, which is thanks to really great work from our colleagues at the health department. Test Yourself DC is a program that is available across the city. Nearly all district residents are within a 20-minute walk of a Test Yourself DC site. You literally can walk. They're at public libraries. Pick up a test kit, do it yourself, administer one to your child. It's just a simple nasal swab. Drop it right back at that site, and then typically results are available within several days. That's a really nice complement to the in-school testing, and certainly we continue to explore other options to facilitate testing as easily as possible across the city. I will use this as an opportunity to plug for those of you with students who are eligible for the COVID-19 vaccine. Of course, then, if a student is fully vaccinated against COVID-19, even if they are in close contact with an individual who is positive, they do not need to quarantine as long as they remain without symptoms of COVID. So another plug, and I think up on this slide, if you can still see it now, there's a reminder about various vaccination incentive sites, certainly lots of resources across the city for both testing and vaccination, and encourage folks to visit coronavirus.dc.gov for details.
Thank you. Next question is coming from social media. If my child starts to feel sick at school, can they receive a COVID-19 test there?
Yes. Again, we have like two programs within one. One is our asymptomatic, so that is randomly testing 10 to 20% of our school population on a weekly basis. And then the other part of the program is symptomatic. And so if your student's presenting with symptoms, our protocol is that that young person is escorted to our health isolation room. We have one of our RN supervisors to come over to the school to conduct a clinical assessment. And then if the family has not opted out of testing and it is appropriate, the COVID test will be administered.
And I'm glad that you mentioned the isolation room because we have another question regarding that. A parent wants to know what happens in the isolation room and does their child still receive some sort of instruction, especially if they're not able to pick them up right away?
Sure. So our health isolation rooms are manned by health professionals, not teachers. But, you know, typically in those situations, we know that a student is going home. And so we'll, you know, try to, the schools will try to get the students book or book bags with them. So they have some instructional materials that they can engage in while they're in the health isolation room. But it is, you know, pretty much set up like, you know, a health suite. So there are just a few desks in there because we, only want to have a minimal amount of students. Those desks are separated. And we do a lot of cleaning protocols in there, so there's not like extra instructional materials there. But young people are able to bring, if they have a book bag, a book they'd like to read, so that, they're able to kind of stay engaged so their families are able to pick them up. That is something we do try to support.
Thank you. And our last question is going to go back to the phone lines. Susan Shorter has a question. Your line is unmuted, Susan.
Great. Thank you for taking my question, and also thanks for all you're doing with this. I know there are layers of complexity. We're in unprecedented circumstances, and obviously requiring us to navigate some uncharted territory. My question really has to do with the student athletes, and that is the mayor's mandate requires all student athletes to be fully vaccinated, I believe, by November 1st. So first I wanted to verify and confirm if that is still the case. And secondly, I wanted to see if there is any consideration or option, given that we're almost in mid-October, and even a student having their first vaccine sort of now or soon, there has to be that gap time, and I don't know if it would meet the November 1st deadline. So if you could speak to the confirmation and then the situation with the gap time, that would be helpful. Thank you again for taking my question.
Yeah, thank you for that question. So that is accurate. We are asking all student athletes to be fully vaccinated against COVID-19 by November 1st to practice and participate in competitions. To be fully vaccinated by November 1st, they do need to have their first test by October 9th. And we've communicated that to coaches and athletic directors so that information can be conveyed to students and families. As a reminder, we do have a number of COVID vaccination sites, and we do have incentives for our youth. So we have 3 new youth vaccination sites, one at Fort Stanton Recreation Center, Dorothy Heights and Denton Road Library, and then Columbia Heights Education Campus. We showed the dates and times that they're available, but they are available most evenings, and students can go and get not only their vaccine, but they'll be eligible for our incentives in the $51 gift card and other prizes. We also have pop-up sites at several schools, and then there are district vaccination sites as well where students can receive the vaccine. But the important date is October 9th, and we ask that all families be mindful of that date in preparation for November 1st.
Thank you, Chancellor. And that looks like that does it for all of our questions this evening. Thank you so much for everyone who called in and posted on social media. I'm going to pass it back over to the Chancellor to close us out for the evening.
Yeah, thank you again to all of our panelists for your insights tonight. Thank you, Dr. Schumacher, as our sister agency, in sharing information about our health services. Again, just a reminder that we do have vaccination sites that are available to youth and sites for all across the district. And I do want to remind families, as Dr. Schumacher mentioned, we do have test yourself sites where families have access to resources to test themselves. Thank you so much. We appreciate the support of our families and our important endeavor of keeping our students in school, maintaining the joy of learning, and we're excited to see our students return in person. Thank you to our staff and our families. Have a good evening.